It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelley with more IRG Health Talk.
Rachel Byrne is our next guest, clinical director and occupational therapist from IRG Seattle. Alternative pain management. I know Rachel is somebody that's just come on board.
Yeah, we just acquired the Seattle Center for Structural Medicine last August. Super excited to have them in the IRG family. Gives us a continuum of care that we can provide for our patients A to Z.
Let's talk alternative pain management with Rachel Byrne and Shannon O'Kelley.
Rachel, welcome. How are you?
I'm great. Thanks for asking. Yeah.
Well, I'm glad you're here. Hey, I'm really excited as part of IRG and the president of IRG. So excited to have your folks down at the Seattle Center for Structural Medicine join our family. Again, welcome to the family. We're glad to have you.
Thank you. We're excited to be feeling the support from you guys.
And so we want our listeners, I was so excited when we had an opportunity to bring Seattle Center for Structural Medicine into our care plan because it gives us a continuum of care because what you folks do at the clinic there is unique. It's a little bit different and it's very needed for that patient or patients that maybe they go through the traditional PT or OT and maybe they get better, but they're still got some lingering problems such as some postural dysfunction or some pain. Tell us about your practice and the clinic there at the Center for Structural Medicine right here in Ballard. You can get great care there.
Yeah, so we're in Ballard. We're right near the Ballard Locks, and we have a team of 3 occupational therapists and 2 movement specialists. So we practice integrated care. So we work as a team. We do an evaluation and we look at the myofascial length testing of the person's whole body, no matter what body part they're coming in for, because we see that everything is connected in a really complex system. So we look at the whole body and we look at each person individually, no matter what their diagnosis is, and then we come up with a customized program for them and we treat them as a team.
And that team approach is very effective. I mean, in medicine and healthcare today, we hear the words collaboration, we hear the words mindfulness, we hear the words treating the whole body. But what you guys do in the whole body aspect is really getting into the connective tissue. And I think just recently, science or medicine has come out and said, we have this other organ, the fascia. Tell us about myofascial and how important it is when that stuff gets tight and restricted and doesn't move. It affects the whole body.
Right. So I like to think of the fascia as a 3D spider web. It surrounds all of your muscles, the nerves and the blood vessels and the veins are all within this connective tissue network. And it's throughout your whole body. There are some trains of fascia, long lines that allow you to be upright in space. And there's a balance and a push and a pull of all these fascial structures. And if they get dehydrated or if there's scar tissue or an injury or even sometimes, in a lot of cases, an emotional component or a postural component, it affects the way that you move through space. It causes pain. It creates pathways in your brain that are abnormal. So we work on this complex neurofascial system in order to help people in their road to recovery. And we really try and hold people accountable for what they're doing at home in terms of self-care. We teach a lot of mindfulness. We recommend meditation a lot. We talk about diet. We talk about ergonomics. So we're really holistic. We look at every part of the person's life.
Well, that's what I love about the Seattle Center for Structural Medicine is exactly what you just described and talked about. The reality is we're starting to understand whether you're an occupational therapist or a physical therapist. You mentioned it's mindfulness. And I think as providers of healthcare, spending time with your patient and getting to understand coaching and instructing and really appreciating where they're at between the ears is so important in today's world. We had a spine surgeon on recently that has spent many years, doing surgeries on spine, and back pain is a difficult situation. And over the years of his practice, he has really bought into this mindfulness and using mindfulness as part of the rehab continuum, and the outcomes are improving. So we can't forget about the mind, can we?
Definitely. And the way that you experience the world is determined through your mind, and then that manifests in your physical body. And we work a lot with chronic pain, and we need to look at the whole person.
We continue with our conversation on alternative pain management with Rachel Byrne, clinical director and occupational therapist from IRG Seattle Center for Structural Medicine, coming up after this time out on Como.
It's a Northwest Lifestyle Weekend on Como News. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelley.
Our show continues with Shannon O'Kelley and Rachel Byrne.
All right, Rachel. Hey, great stuff. You're doing a fantastic job describing what you do at the Center for Structural Medicine. As you can tell, as the president of IRG, I'm really excited to have you folks join us because there's a huge need for what you do. And I hope people listening really realize what you guys can do for them down at your center. But tell us about your treatment techniques, maybe some of your procedures and what you offer there, because it's really cool. You have a continuum of care that's, I'm just going to say it again, really cool.
We're definitely unique. Yeah. So when someone first comes to our office, we do an evaluation. We do postural assessment up against a grid. We take a complex past medical history. We'll talk to you about how you manage your stress, how you hydrate, what your food intake is like. And then we do myofascial length testing. So we're looking at non-compensated range of motion in functional planes. And then we offer services such as Byrne therapy, which is a soft tissue cross fiber manual therapy modality that helps switch your nervous system out of that fight or flight phase into the rest and digest phase and interrupts postural patterns and pain patterns. We do myofascial release, which is can be a heavier technique. Some people also call it structural integration, where we're trying to organize the body in a certain sequence of sessions. And we offer acupuncture at the clinic. We also offer acutonics, which is using tuning forks on the meridians instead of needles. We offer something that's very unique and cutting edge called Tensegrity Medicine, which is the way to approach the body as a structure that has this push-pull tensile force that I mentioned before. And we look at those fascial lines and we unwind the structure from a superficial to a deep perspective. We also do a technique called ligament stimulation, which is a reciprocal inhibition, also known as contract relax, and we're trying to inhibit those kind of tighter muscles with our hands on the ligaments. And we do lots of postural work. We train in home exercise programs. We do functional movement. We offer gyrotonic and the melt method, which are basically self-care. So they're ways to take care of your own fascia at home. So you leave the clinic with a solid idea of knowing how to take care of yourself.
Which every clinician really wants their patient to become independent and self-sufficient at home. So the educational aspect is huge. Aren't you also doing some kind of specialty in yoga training right now?
Yes, I just became a yoga teacher, certified with the Yoga Alliance. And we're going to offer one-on-one individualized yoga plans. And that really is going to be customized for that person. It's going to help with strengthening, with balance. I have a client right now with Parkinson's, and we're working on a yoga program for her.
Great stuff. You folks down there do a fantastic job. I've seen patients that have seen and come to your clinic, and what they say is fantastic. They have a great experience. Thank you, and welcome to the IRG team.
Thanks very much, Shannon.
We've been talking about alternative pain management with Rachel Byrne, clinic director and occupational therapist from IRG, Seattle Center for Structural Medicine. IRGPT.com, of course, has all the information. Just more and more information we're getting and more ways to deal with pain like these things she mentioned.
That's right, Tom. The fascia, or the connective tissue, has recently been discovered as this new organ, and that's the focus, that these providers really get into the soft tissue and repair it, restore it, and rebuild it.
All right, Rachel, thanks so much for being with us. We're back with our final segment after this time out on Como.